With 70% of people in the rehab field stating that they are looking to make a professional change and 9% resigning, it begs the question, what is happening in the field of rehab and what is driving the desire for professional change? I'm going to try answering these questions on this episode. It depends. I know, it's a favorite phrase every student and clinician wants to hear. So this podcast is here to help. Welcome to the It Depends podcast, the podcast that answers the burning questions of a curious and driven physical therapist. This podcast is a deep dive into clinical and professional topics in the field of physical therapy, providing actionable tools and strategies early professionals and students can use to be impactful in the field of physical therapy. My name is Ochuko, and I am a practicing clinician, educator, and specialist in cardiovascular and pulmonary physical therapy. Welcome to the podcast, and I hope you enjoy it. Back to the report. Before I continue, I must make mention that I do not work with WebPT, but I am grateful that there are organizations in the industry taking on these tasks and providing objective data on the state of our profession. With that being said, I'll start with a critical appraisal to provide scope of the report and provide context and limitations to consider when interpreting the data and key takeaways. I want to start with the method and demographic data. In order to do this, I'll compare the data to the most recent APTA report from 2016. The WebPT survey was not just for physical therapists. They also had managers, executives, students, speech and language pathologists, and occupational therapists. When we look at this report from WebPT, we see that 65% of the participants were WebPT members, and there was no mention of using APT-affiliated sources to distribute the survey. There were 6.6 thousand respondents versus 7.5 thousand respondents from the 2016 APTA report. On this report, 64% of the respondents identified as female compared to 69.4% from the APTA report. And out of the 6.6 thousand respondents, we had a mixture of individuals here. Broken down, we see 3,542 therapists. And that includes speech and language pathologists, occupational therapists, as well as physical therapists. So when I'm speaking about therapists on this report, it's specifically talking about SLPs, OTs, and PTs. Sometimes it does break it down, and in this report, there were 2,640 PTs that responded. And then as far as PTAs goes, there were 441 PTAs that responded and 327 students. As far as the students goes, this was not broken down, so I'm not really sure what type of students these were. And then if we look at the Bureau of Labor Statistics, there's a reported 225,350 physical therapists and 93,660 physical therapist assistants as of May 2021. When we compare this report from WebPT to the overall size of the population, we see that our profession is made up of 30% PTAs versus on this survey, we have 6.6 of the respondents being PTAs. So PTAs are underrepresented here. And I think this is important to point out because PTAs are vital for our profession. And it is always highly recommended, in my opinion, that when we have these type of surveys, we want to have PTAs involved so we can know what is happening from their perspective. Going forth with the demographic information, we see a little more than half of people who responded being under the age of 33. So what does this mean? Well, with the ongoing addition of PT and PTA programs, we will likely see a widening of this younger demographic. And this is good because younger workers usually means there's going to be more workers working for a longer period of time. But this can also be negative from a competition standpoint. The APTA reported that clinician supply is outpacing demand and predicted that by 2030, there will be a surplus of 25,235 therapists. So once again, it just means that potentially there's going to be more competition between therapists, especially down the road when we have more therapists that are coming into the market. Enough of the demographics, let's move on to clinical practice trends. First off on the report is the distribution of clinical practice. Basically, what is the dominant practice setting amongst people who responded to the survey? So to no surprise, outpatient private practice was the highest practice setting with 48.4% of respondents saying that's where they work, followed by outpatient hospital-based rehab facility, which was reported as 12.4%. And that is on par for our profession. We do see the outpatient setting being the dominant setting for our profession. So if you're a student coming out of school wondering where most of the options are going to be in terms of employment, It's going to be either in the outpatient hospital-based rehab facility or outpatient private practice. Then looking at how the healthcare environment is evolving, and you can definitely work on other skills in specialty areas or even work towards a specialization because currently not a lot of clinics are branching out into these areas. And in doing so and gaining these skills, you will likely be one of the few people with the experience to fill in the need if it ever comes. So, for example, COVID came around. If you did have a cardiopulmonary background, that is something that would have been very useful because a lot of clinics were then looking for people who are competent and capable of managing these populations. But it can also be a problem if you specialize in an area, right? The problem here is the volume and cost needs to make sense. And since it's a new territory, this is a lot of risk and businesses might not go into that. So if you do go into these new territories and work in specialization, know that it might not readily be available in terms of positions, and you might have to build it. So once you go into the workforce, if you're not familiar, a lot of businesses are going to track your performance, and they track this using what's called KPIs, key performance indicators. So with the KPIs that were reported here, we see major KPIs that businesses are looking at. And this is very important because now you know potentially how these organizations are going to be monitoring your performance and also what they're looking for. Cancellation and no-show rate, revenue per visit, units per visit, visits per case, and visits per full-time therapist were reported at higher rates as measures of interest compared to other key performance indicators. When we look at these KPIs, we see that clinics that responded, 69% of those clinics are actively measuring visits per full-time therapist, and 17% have a desire to measure this. So regardless of where you work, more than likely that clinic is going to be measuring your visits. And this might seem scary. And it's obviously known that when you start off, you might not be as efficient, so you might not be seen as much as an experienced therapist. But this is one way you can leverage yourself in the marketplace. Because if we have these measures and you're outperforming other people or outperforming the market, it's one way that you can market yourself and leverage the skills that you have. Looking at the other KPIs, you can also then use some of these tools to say, I am excelling in these certain areas. So when you go to your interview, these are going to be talking points. I'm seeing this many people per day. This is my billing practice. All of that is going to be beneficial. Managers and clinics are going to want to hear that type of information. An additional strategy here is to take this list of KPIs that are seen from this survey and be the one to suggest or initiate measurements of KPIs if your institution is not doing that already. If it's not being done, it's going to be a lot of work. So you can be the one to volunteer and say, I will manage the data. And this makes life easier for your manager and everyone is happy. And by doing this, you create value not only for the manager, but you also start accumulating objective information that you can then use to demonstrate and highlight your accomplishments, your performance as a clinician. And this can be added to your resume, and you can use this as a leveraging tool in interviews and position yourself as a high performing applicant. So there are many routes you can take to leverage this set of data with KPIs. And the next set of data to look at is what organizations report as needing the most improvement. And this is going to be in the area of workflows, right? The day-to-day task that they're completing. And the top 3 workflows ranked as requiring improvements were linked to some level of software and technology. And with the rise of technology services and products that a lot of you might be using already, this can be another area that you as a clinician come in and provide value. Because if you're already familiar with some of these technology services and products, you can then go ahead and propose these. And since you're already familiar with it, you can then improve the workflows that these companies might be having trouble with. And next up is growth strategies from these companies. So in the next few years, what do they plan on doing to grow? For the most part, it looks like most institutions are looking to open more clinics as part of their growth strategy. So if you're in the market, know that there's going to be a lot of new clinics popping up in the future. And this is going to be an opportunity for you because obviously new clinics need therapists, but those clinics are going to have their unique challenges. And dependent on the size of the institution, this is a way that you can provide value, not only to gain employment because those clinics do need staff, but You can stand out by being the applicant that is knowledgeable and has skills to help these new clinics thrive. So the opportunity here for you, if you're in the market for a job, is to hone and demonstrate skills that will be beneficial for these new settings. When it comes to those skills, we can have soft skills or hard skills. So soft skills, such as the ability to adapt to changing work environments, flexibility to your workflow, teamwork, and supporting workplace challenges will be valued when you go into these new clinic scenarios. And as for hard skills, managerial, data, and resource management skills will be very valuable. And if you're a senior level therapist, you're going to have a lot of leverage here because your unique value will be in bringing your experiences with billing practice, EMR management, troubleshooting, and interprofessional collaboration. So all of these skills you can bring to the table to help stabilize these new ventures and possibly also be a mentor to any of the new therapists that are coming in. Dependent on the size of the clinic, different strategies will be beneficial. So if you're looking at a large group, if you're applying to a large group, right, there's a lot of clinics that they have already, or they have a lot of therapists. If they're opening a new clinic that you are interviewing for, more than likely in this scenario, they already have standards and procedures, and they might even have a department that's going to ensure everything is done to a standard. So soft skills here will be more useful, right? Because all the hard skills, all the technicalities will already be accounted for. But if you are then going for a smaller group, they may still be developing and optimizing their standards and procedures. And this is especially true if this is their first clinic that they're opening, or if they don't have a lot of satellite clinics, or if they're just going into a new market. So as a therapist, understanding the size of the clinic, what they have already is going to be where you can then market some of those hard or soft skills. So as you might guess, there will potentially be internal stress that's caused from changes, right? With a clinic expanding or a new acquisition. So if you're already working in a company, there's a high likelihood that that company is going to open a new clinic or potentially acquire other clinics. So this is an experience that you'll likely go through. Okay, moving on, I want to talk about the financial state of businesses before we transition to personal reports. So when we look on the business side and we look at annual revenue, we see 64.3% of clinics are making $1 million or less annually. When you look at the institution size, unsurprisingly, you see an increase in revenue as provider size increases. So larger companies with more clinicians are making more money. But when we look into it some more, we see that there's a flattening out of annual revenue in clinics. And we see that between the 6 to 50 provider range. So even though overall, as provider size increases, we actually see no relative growth in this group based on the data. So in this segment, the revenue ranges from 1 to 5 million. So if we hold this assumption that revenue will increase with the number of providers, we can look a little deeper into the data to see how revenue performance deviates between segments based on their size. And we can then have a better look at how efficient some of these clinics are based on their size. So taking the reported revenue and provider sizes, we get the following trend. What we see is a binodal distribution with two peaks at the 6 to 16 provider range and the 150 plus provider segments. This distribution shows the highest reported revenue per provider segments are these two, with the lowest performing group being 50 to 149 group. I believe this outcome, like any of the other outcomes I am discussing here, is skewed and it's likely due to how the data has been categorized. With that being said, this is what the data is saying. And with that, we can see a potential drop in efficiency after a certain volume of providers is exceeded, that then rebounds after a certain threshold. This will be an enlightening revelation for administrative teams as it proposes an area for improved performance compared to other segments, especially if their institution belongs to the 50 to 149 segment. So it would really be interesting to see if this trend holds true with more robust data sets. I want to then transition more towards the personal side of the report and discuss what clinicians are actually going through. And this is an area I am very curious about because of the anecdotal report of burnout and pessimism that I have seen in the field. So turnover is one of the first topics the report goes into. Turnover is when the clinician is not employed as a therapist, which can be for multiple reasons. So high turnover will mean a lot of therapists are not employed as a therapist. A few trends emerge from looking at this turnover data. And the glaring trend across the board is the high prevalence of physical therapist turnover, except for physician-owned practices and in that 50 to 149 provider segment, we're seeing a lot of turnover in general. And then coming in closely after physical therapists are clerical staff, so billing department, front office. And this group reported high turnover in all practice segments except community hospitals. Another interesting trend here in turnover is the increase in prevalence of turnover with occupational therapists as the volume of providers gets above 17 providers. The report showed a 8.8% resignation rate among the respondents, which is 2 times greater than the general healthcare industry. And we also see increased rates of resignation in larger provider segments, especially in the 50 to 149 and 150 plus categories. So the more providers, the more we saw resignations. This then begs the question, is it the institution or is it the providers? Who is driving this resignation trend? From the clinician perspective, we are seeing a decent sized volume of therapists looking at professional changes for reasons such as work-life balance, changing company culture, professional growth, salary benefits. And these could all be driving these changes that are reported. And then if we look at the variables and see what is reported, specifically with workload, we see workload is one of the biggest complaints from providers. Looking at workload, specifically patient per therapist data, we see a trend for an increase in provider caseload as the size of the organization increases. But in general, 13 patients per therapist seems to be the norm. One segment with the most patients seen per therapist was the segment with 50 to 149 providers. On average, therapists in these settings were seeing 17 patients. The next data that was looked at is salary. This is a big one, right? So for providers and assistants, insufficient salary was the most reported reason for considering a professional change. And when looking at what respondents ranked as being important factors for their job, salary ranked second for assistants and managers and third for providers. So salary is a big deal. It's one of the top 3 considerations when people are looking at a position. Salary is consistent with the APTA and the Bureau of Labor Statistics. We see 50% of therapists reporting a salary of $60,000 to $90,000 annually, and 32.9% of PTs making above $90,000. Interestingly, 41% of occupational therapists made above $90,000 annually. All right, go OTs, you guys are crushing it. But where are you going to maximize your earning potential, right? What setting makes the most money? So when we look at the percentage of therapists making 6 figures or above, respondents in the gym or wellness centers, we're seeing 13.4% of those respondents making 6 figures above. And then in the mobile therapy segment, we see 14.2%. And then for outpatient multidisciplinary practice, we see 16.6%. And for home health, we see 16.8%. Outpatient private practice, 17.6%. For SNF, skilled nursing facilities, 19.7%. Other category, not really sure what's in there, but it's possibly non-clinical roles. We're seeing 21.4% of respondents there. And then for physician-owned practices, we're seeing 23.8%. And for the outpatient hospital-based clinics, we're seeing 29.1%. And for inpatient hospital, we're seeing 33%. So hospital-based systems are going to be where you see a lot more individuals making above 6 figures. So that's possibly where you might want to go if you want to maximize your earning potential. For highest earners, we see private practice and other category reporting the higher percentages of clinicians making over $150,000. One practice setting that stood out in the data was the 50 to 149 provider size group. As we saw, they underperformed compared to the other groups based on lower revenue to provider size ratio and also higher therapist caseload and higher numbers of resignations. So that is it for this episode. I hope this podcast serves you well as you go on your professional journey. Thank you and see you on the next one.